Hello viewers, my name is Dr. Rajiv. Welcome to my education channel, YouTube Surgery and Orthopedic Education. Today, there is an online lecture on the general aspects of tissue engineering and regenerative medicine, popularly known as TERM. In the end, please subscribe to our channel and give us a like if you find the lesson useful. And also, don't forget to press the bell icon below to get my videos regularly. The discipline of tissue engineering and regenerative medicine, or TERM, is relatively new. It has a great potential to revolutionize the treatment of a wide variety of human diseases, including spinal cord injury, neurodegenerative disorders, cardiovascular diseases, degenerative renal diseases, type 1 diabetes mellitus, and diseases of the musculoskeletal system. The repair or replacement of injured or diseased cartilage, skin, pancreatic islets, bladder, intestine, heart tissue, large arteries, larynx, and bronchus may also become possible with the help of stem cell technology. The tissue engineering is defined as the application of the principles and methods of engineering and life sciences to create new tissues and organs. The limited ability of tissues to repair themselves has paved the way for cell therapy and engineering to repair or replace diseased and damaged tissues. The three pillars of tissue engineering and regenerative medicines are cells, scaffolds, and chemical signals. Cells include stem cells, progenitor cells, and differentiated cells. Scaffolds are either natural or synthetic, and chemical signals used are various growth factors and chemotactic factors. The use of biological dressings, scaffolds, stem cell therapy, and gene therapy is an example of tissue engineering in which new tissues are created rather than transferred. The goal of tissue engineering is to make functional constructs to restore, maintain, or improve damaged tissues or whole organs. Artificial skin and cartilage are examples of engineered tissues that have been approved by FDA, but currently their use is limited. In most cases, cells and tissues are expanded outside the body and then implanted to replace the diseased or damaged tissues. These processed cells are implanted either naturally or after having been incorporated into synthetic or natural tissue scaffolds. Not only direct therapeutic application, but tissue engineering also has the potential to build in vitro tissue models for use to test drugs for efficacy and toxicity. Stem cell biology, particularly how different types of stem cells can be derived and engineered in laboratory to differentiate into specialized cell types, is a cutting-edge research field with potential clinical applications. The technology of manufacturing scaffolds to seed cells on or to encourage interaction with host cells is also developing fast. This field has potential to allow cells to create tissues and even organs in vitro for therapeutic purposes. Many types of bioreactors are under development that provide an appropriate physical environment for growing engineered tissues outside the body in a laboratory. Despite these challenges, this field continues to evolve. Implantation of engineered tissue scaffolds is a critical step in tissue engineering. These cell-seeded scaffolds are either cultured in vitro to synthesize tissues which can then be implanted into an injured site, or are implanted directly into the injured site where regeneration of tissues or organs is induced in vivo. The ability of tissue-engineered scaffolds to recreate the native tissue microenvironment, including the topographical, mechanical, electrical, and biochemical characteristics, is important. A scaffold can be successful therapeutically only if it becomes fully integrated into adjacent normal tissue and can be remodeled appropriately in the recipient. For example, with regard to the musculoskeletal system and the cardiovascular system, the native tissues have to bear considerable mechanical stress of contraction and relaxation. Bioengineered tissues are not subjected to matching mechanical stresses during their manufacture in vitro. Hence, their behavior in response to mechanical loading after implantation is a major determinant of their ability to perform successfully. Engineering tissue in vitro presents several challenges. It is difficult to supply adequate oxygen and nutrients uniformly to tissue constructs and also to ensure different nutritional and growth requirements of different cell types being grown simultaneously. Limited size of tissue constructs and integrating these constructs in vivo remains a major obstacle in the field of tissue engineering. The nature and profile of the tissue or organ being engineered also pose technical challenges. Flat tissues like skin, cornea and cartilage present fewer problems than complex tubular structures such as trachea, bronchus and large blood vessels. Hollow organs such as bladder and gut present a much greater challenge, whereas solid organs such as the liver and kidney present the greatest challenge of all. Obtaining adequate numbers of differentiated cells and maintaining their viability and desired function are also major challenges. Preservation of tissue structures, surface composition, and architecture require further research. The issues of recellularization, vascularization, and immune reactions from decellularized tissues need ongoing research and innovation. Despite the therapeutic potential of tissue engineering, there are several risks of harm to the patients, trial participants, or both. These are related to the presence of living cells such as immunogenicity, mutagenesis, and tumorigenicity, and also to the scaffold components such as transmission of infection, immunogenicity, and cytotoxicity. A major concern is the teratoma formation by and malignant transformation of the transplanted cells. This risk is maximum with embryonic stem cells (ESCs) and induced pluripotent stem cells (iPSCs) and little with somatic stem cells (SSCs). Teratoma formation is one of the hallmarks of pluripotent stem cells. This risk may be reduced by using only fully differentiated cells for stem cell therapy. There are also concerns around rejection of cells after injection or transplantation. Immunosuppression side effects and immune rejection may occur if the patients are immunosuppressed to prevent rejection of the allogenic cells. Regenerative medicine is an emerging field that combines tissue engineering with material science, stem cell biology, and developmental biology for repairing or replacing tissues in a wide variety of human diseases. The field is changing rapidly with new developments in stem cell research and scaffold design. Mesenchymal stem cells, MSCs, induced pluripotent stem cells, iPSCs, and stromal cell-based therapies shall be the main tools of tissue engineering. Improved bioactive scaffold designs that can be reproducibly manufactured and seeded with multiple cell types and sophisticated bioreactors are likely to dominate the scene. Patient characterization according to phenotype and genotype and to profile patients at a molecular level will allow more detailed formation of patient subgroups and staging of disease. This would refine the surgical approach to many diseases and regenerative procedures.